My name is Anna Matonti, and I came this country in America, in New York, 1955. Then we moved from New York, we came to New Mexico in 1969.
My name is Giuseppe Matonti. I came to the United States in 1956. I came to New Mexico in 1969. In Daniel, we bought 1 acre of land. And when we saw the land, we fell in love with the weather. Because it was 100 degrees in the shade and nothing happened. We don't sweat and nothing. In New York, with 85 degrees, it's like somebody throws water at you.
My name is Rosa Matonti, and I am the daughter for Joe and Anna. They've been married for over 50 years.
My name is Maria Matonti. I'm the second daughter of Joe and Anna.
My mother was pretty much an active woman until her 70s. She had a bad back, and so required the implantation of a morphine pump. About 9 years ago, she had to have it refilled, and at that time it was not accessed properly. She almost died. She was resuscitated twice prior to getting to the hospital, and that began kind of a downward spiral in her health. So for the first year post-discharge, she was probably in the hospital about 11 out of the 12 months. September, she was hospitalized because she could no longer walk, and at that time she became completely paralyzed. About 3 years into Mom being sick, she requested that we no longer take her to the hospital. She was ready to stop, and to stop all extraneous measures for her care. She no longer wanted to go to a hospital. She no longer wanted that type of care. We had the home health care, the Presbyterian home health care, that the nurses were coming in. And one of the nurses had suggested hospital at home and said, maybe we can get these folks to come in and see your mother and take care of your mother. And that way they can do an assessment while she's in her bed, and they can really check and see if she's doing well. And that became our starting point with hospital at home and the wonderful journey that they have provided for my mother and for our family, and the support they've rendered to us.
My name is Melanie Van Amsterdam. I've been a physician for 17 years. So I am an internist, and I'm double boarded in hospice and palliative medicine. I have been working with the hospital at home program since its inception in 2008. The first time I met Anna and Joe and the rest of the Matontis, it was for a hospital at home admission. And Mrs. Matonti was so sick. I really didn't think she was going to make it. But we treated her. I think it was probably a pneumonia that first time. And she came through it like a champ. I think the care is just so much better. Mostly because the families are providing care and the patients are in their home. It's a familiar environment, a safe environment for them. All our data has shown that people fall less. They die less frequently on hospital at home. They have less undesirable outcomes like infections that are acquired, like they would be in a hospital. So our safety and our outcome ratings are through the roof. I really need to say that working with families like the Matontis has been the best part of this, without a doubt, because you really get to know your patients and develop a relationship with them that you can't in a 15-minute office visit. And so that's been enriching for me.
The clouds are sky parted, and the angels sang. It was that much of an impact because, now for the last 5 or 6 years that she's been hospital at home, she's contained. So she's picked up no new illnesses. We started with hospital home after she was out of the hospital, probably by 2nd to 3rd year. So we've had these extra 6 years because of the hospital at home program. We have taken care of her with multiple infections in the home. We've administered IV antibiotics in the home. We have done wound care in the home. We've used wound vacs, which are very advanced forms of wound healing products. We have utilized high concentrations of oxygen in the home. We have done her rehab in the home.
We've had and done a number of things in the home that would have been relegated to a hospital, but we've been able to do that in the home setting. My mother says it all the time. I thank God for the doctors at Hospital at Home because they made it so that I can live the rest of my days here with my family. She will not go back to a hospital. She's told us that. And she's healthy, and she's happy, and we're happy as a family. And I know that my father's happy because he has the woman he loves with him. I don't know how happy he would be all alone, right? You get to a point in your life where you can't be without the person you've been with more years than you were alone.
We cook something. I told him what to do, and we managed.
Well, she tell me what to do. Otherwise, I don't know. I never done it before. Before my wife got sick, I couldn't even boil an egg.